Hi, everybody. I am so excited today because this is a bucket list visit for me. I'm at Boston Healthcare for the Homeless, and this is Dr. David Munson, and he just gave me a tour of the facility. And first off, many of you have seen many years ago, I interviewed Dr. Jim O'Connell. We were working together on 100,000 homes when it was early on many years ago. Interviewed him develop the vulnerability index, which he did. And you guys, it originated from here, correct?
Yep, so from some data that we originally kind of came up with earlier in the program, yep.
So I've been around a little bit, and I love the healthcare for the homeless. They're in most major cities, but oh my gosh, what a wonderful place.
Great.
And so they're in over, well, you tell me about it. You said 60 facilities, 20 doctors.
Yeah, so we're really an outreach organization at our heart. So we have our main site here in the south end of Boston, but we're really spread out in about 60 or so different clinical sites throughout the city of Boston and the surrounding communities.
And how many doctors, nurses?
So yeah, we're a pretty big organization. We have about 25 or so docs, upwards of 40 nurse practitioners, PAs, and close, probably more than 100 nurses, and then a whole army of support staff that really help keep the whole place running.
It's amazing. The whole facility, we just walked through the respite care,
yep,
which is actually where we are at. We're in the administration office. The facility is several floors.
Yep, so we have three floors. One floor is sort of a non-clinical space, and then 2 floors of clinical space, 104 total beds.
And I totally forgot because I was like, wow, this is such an amazing facility. And you reminded me, Massachusetts has health care.
Yep. So, basically, chronic homelessness has enabled, the way the laws have been written in Massachusetts since the mid-'90s, really. So that anyone who's chronically homeless has Massachusetts Medicaid, which is a robust and really good health insurance. Unbelievable
being able to. So there's a couple of things that happen because when we just talked to Tommy, who had pneumonia and went into the hospital, and he probably got well enough to be discharged, but not really well enough to be on the streets.
Exactly. If he goes back to the streets, he's going to, get sicker, probably get readmitted, or could have a worse clinical outcome. So he can come here directly from the hospital and get well enough to either go back safely to the streets if he wants, or hopefully really to kind of engage in some ongoing treatment.
Right, and he was going to program, trying to get sober,
yep,
a couple other things, and there's several other people that we met. And you told one story about somebody that, and Housing First model is being utilized here.
Absolutely.
And,
one of the first places for Housing First.
And one of the issues is housing stock. So there was a gentleman that is qualified.
Yep.
But 18 months.
Yeah, yep. He's had a housing voucher, and he's been, waiting for a unit, trying to find a unit with good support, housing support workers that are searching, but just the available housing stock is really tough in the city right now.
And that must be everywhere. And my point in all this is housing is healthcare.
Yep, absolutely.
And we need to make changes. And it saves lives and saves taxpayer dollars. So whether it's your heart or your wallet, either way, you have to support programs like Healthcare for the Homeless, Housing First, shelters that work as a system getting people into their own apartment or reestablishing their life. And too amazing. Anything else that you'd like to add?
No, it's been wonderful to have you here, and I think your work with sort of showcasing the lives of patients who are and folks, really individuals who are invisible otherwise, is really fantastic.
Well, thank you very much. I'll put links to how they can find you. Dr. Jim today has been busy.
Yep. He sends his regards.
So I took him off my Christmas list, but David was so nice, and this is such a wonderful facility. You're back on my Christmas list, and I'm going to return because I wasn't able to go out on the streets with you guys, but I really have to go out and hit the streets.
Yeah, absolutely.
I have with Dr. Jim Withers. I mean, I love the model of house calls out on the streets.
Yep,
so.
absolutely. We'd love to have you back.
Thank you, everybody.